Let's get real. Let's get loud on America Out Loud Talk Radio and Focal Point Substack. I'm your host, Dr. Peter McCullough. It's a great pleasure to welcome to the show a real innovator from Sao Paulo, Brazil, Dr. Roberto Zeballos. Dr. Zeballos, welcome to the program.
Thank you very much. It's an honor. I think when we think in the good for all community, things happen like magic. And I'm very proud of your work, Professor. Here we have a kind of censorship, even though I still publish your comments in your publications. So, but we move forward. When we have love on your heart and think in third people, the things go like magic. Thank you very much.
Well, in many ways, your recent paper is magic. Let me read the title, Dr. Zeballos, for our listeners. The title of the paper is published in ID Cases. It's just come out. The title is Post-Spike Syndrome, PSS, Simple Solution Leading to Resolving Results, 5 cases in the report. You're the first author in a cadre of very well-respected scientists, really a tour de force of the Brazilians. Why don't you lay out the rationale for doing this study and methods and what you found?
Well, I believe that the observation, people are forgetting about observation. I'm a general physician. I like to think, I like to observe, and I believe that in the lost art of observation. And what I do is very simple, as I did when I created the oral protocol for steroids in São Paulo, Brazil. There is a paper that we published because we understood that what was causing the disease and the COVID was the inflammation. And if we suppress the inflammation in an optical phase, then we solve the problem. And like magic, we solve the problem. Look what happened. Look how curious it is. I didn't have any long COVID on 2020, 2021, 2022, 2023. No, 2022. I didn't have any long COVID. I had but just a few. Mm-hmm. Well, at the end of 2022 and beginning of 2023, it started to show up in my office 3 to 4 cases a day with those symptoms with long COVID that you know, that is fatigue, malaise, brain fog, reactivation of previous rheumatological disease, developing neurological disease, all the things that you already know. And it was weird. I said, what happened? This Omicron strain is able to lead more long COVID. And then I was watching a live between Dr. Shankara and Philip Macmillan. This was on February 2003. And they told that there was a paper telling that the virus was able to replicate inside the bacteria from the gut. Well, I said, that explains a lot. Maybe these bacteria are some bacteria with dysbiosis, let's call it this way. It's helping the virus to replicate, create an inflammation, and then we have a chronic source of spike, of the virus or spike. That was just one idea that I have. And I'm very intuitive. What I did is, I choose a kind of probiotic, anyone at the first moment. I choose to give 5 days antibiotics. I, inspired on you, I use Nattokinase because it can destroy spike at least in vitro. And then I give Ivermectin because Ivermectin can block the virus action. So I got surprised because 4 weeks, 6 weeks, all these people with this long COVID or post-vaccine syndrome, they improve very fast. And then I had a problem how to explain all this. And then I watched a video from Dr. Sabine Hazen. And she told that 3 months after the vaccine, there is no bifidus. And then look, see how I'm lucky. I looked to the probiotic that I intuitively, it was intuition. that I choose, there was 3 bifidus, 3 types of bifidus in microbiota. And then that's explains a lot. Then I went to study the bifidus. I didn't know that. I didn't pay. I am here 39 years doing my practice. I didn't think that the gut microbiome was that important. And then I start to study, and I see that the bifidus is able to produce short fatty acids, which are very important for cognition. There was a study before the pandemic, before COVID. There are a study from a doctor called Ho, telling that Alzheimer patients, as when we get old, they decrease in bifidus. And then I see that the bifidus, there are some papers showing that it protects the membrane, it protects the filter from the intestine to the bloodstream. So it keeps the barrier of the intestine, it keeps the integrity of this. And then I said, well, this explains a lot. This explains a lot. And then I said, I need to publish a paper. But I am here in my clinic. I see a lot of papers every day, a lot of patients every day. And I don't have the time to do as a master expert in research as you are, to perform, select a group, we need money. So what I did, I saw all the people getting better. And then what I did, I pick up 5 emblematic cases. Mm-hmm. They look like miracles. And then in the discussion, I try to explain why it works. Because what doctors need to understand is that there are 2 eras in medicine. One before COVID, another after COVID. And then they need to consider spikopathy. In those models, they have old models of disease that does not fit the new model. You know why? Because the source, because the etiology is different, is a spike. And as you always showing this information in papers, but as the spike goes over to all vases, all small vessels in the organism, they can give any symptom from heart, brain, and intestine, and all. They can give any symptoms, and the spike can bind to the CD4 cell, and they suppress immunity. But it's just one small protein that, according to David Martin, he calls it as a bioweapon. But that's not the subject here tonight. So what I observed in my first case of COVID is that the disease starts on the base of the lung. And that's in the base of the lung is where there are more vessels, more circulation. And then by that time in 2020, I said, well, this is a systemic vasculitis. That's what I thought. And now, I don't know if you have the time to read the paper, but all these 5 cases that I'm going to explain, at least the more emblematic one, all they fit in the vasculitis etiology. Mm-hmm. All of these 5 cases, the only thing that changes is where the vasculitis occur. So what happened is, besides trying to explain our results, I'm very grateful to you, to Dr. Sabine Hazens. She was an inspiration. And she sent me that paper that you just sent to me about that the babies doesn't have more bifidus. And I believe because a healthy gut, we need to have diversity. It's not the bacteria which is there. You need to have diversity or diversity. I don't know how to say, but we need to have diversity. But I believe in the specific COVID context, the major bacteria which is missing is where all the unbalance starts. Because that's amazing, look like a miracle. I give a lot of bifidus bacteria. I give a lot of bifidus. I think it doesn't work if you give just 1 capsule a day. I give 3 capsules a day. And it works, Professor, in a way that I love your protocol and it works. But if you add some bifidus in your company where you promote, it's a very nice job you're doing, I think you're gonna have better results. What I'm doing, I'm designing a study here at the Institute indoor, and I'm gonna try to find the resource for this, the grant for this, but it will be a small study, one with Dr. Sabine Hazen, when we're gonna measure the microbiome, if there is bifidus or not, we treat, we see the results, and then we check again the microbiome in 2 different groups. One, you're going to apply the protocol, and the other going to be placebo. And then we will try to show what I already know. You know why I know? Because I'm treating people since 2023. So the most emblematic case that I had that is published is this lady who used to have convulsions, epilepsy, every 4 times a week. So the doctors, neurology, and there was a specialist in epilepsy. I didn't know that there was this specialization, but there was 3 of them. And you know what they are experienced? They experienced that if they give the medicine to suppress the crisis, what happened is she sleep. If they decrease a little bit, they couldn't control. And they got lost because they never saw something like this. And she came to me and she said, listen, I want to know because I am also, besides the symptoms, I saw you in a live telling that people can have loss of memory, brain fog, fatigue, tingling on the extremities, and she had all these symptoms. When she came to me, I said, I'm sure that I'm gonna solve the fatigue, the memory, and everything, because I'm seeing these patients. So I'm considering the epilepsy. I don't know if I can help you. So look at this, Professor. In the first 7 days, she had no epilepsy no more, and she had encephalitis. She had encephalitis before COVID that left a scar in her brain. So I said, 7 days, this is not because I changed the microbiota. We need at least 4 weeks, 6 weeks to recover the microbiota from the intestine. So what I realized is that when you give spike protein, as you have a study, when you give Nattokinase, you decrease the concentration of spike protein. When you give Ivermectin, you also, the same way you decrease. So I believe that what was causing the epilepsy, what was triggering her epilepsy was the spike protein. That's the only explanation, because she never had, she was 3 years with this epilepsy. And 30 days, just 30 days after the treatment, she said that she started to solve her fatigue, memory, and everything. And this makes more sense because it takes time to you balance your gut microbiome again. So that was extreme. And then I said, wow. And then there is another case that called polymyalgia, rheumatic polymyalgia. Mm-hmm. She had all the symptoms. And then she went to a doctor. She lives in Hawaii, US. And the doctor explained to her, listen, this in our experience, this takes 1 year to 2 years to improve, but I'm going to give you a steroid and the prognosis is good. Well, she called me and she said that after steroid, her pain, her muscle pain improved, but the fatigue, the memory loss, and other symptoms from the post-spike syndrome still persists. Look what happened. I treat again. I focus on the intestine. And then later you detail how we do this because we need to individualize. But I treat her 3 months. She didn't have more pain, and also she improved memory, and she improved a lot. And then her doctor didn't know what happens because he was expecting just 1 year. And the explanation is simple: 2 years, 2 eras one before COVID, another after COVID. The source of her polymyalgia was spike circulating. And now we can think and speculate. I think that all this increase in mortality that are happening may be due, of course, the production of spike that comes from the vaccine, but also can come from the intestine, that maybe we have a reservoir, I don't know how to say, store the bacteria there, the virus there. And I'm telling this because I'm seeing people who did not get the shot, and they present these symptoms, and they all improve. So that's why I have a question, and maybe I'm sure that you will be able to answer. You remember that EU study telling that people who got vaccinated still has a spike for over 700 days. I know that the vaccine is playing an important role in this case, but I also believe that there is another source. And then I remember that in our test communication, I asked you if we were able to see the difference between the spike from the virus than the spike from the vaccine. I know that the RNA messenger have a pseudouridine that's more resistible. You decrease. It's impossible to. It is not biodegradable. So what happened? What happened is, if you can differentiate this, we can tell that even the vaccine that decrease and kill Bifidus bacteria, also we can have this new different strain, which is replicating inside the virus in the intestine. And so these were two emblematic cases. There are some cases that came with polyneuropathy, very well documented with neuromyography, and it improves. It improves dramatically, because maybe what was causing was a spike circulating. And you know what I do? I learned with you, Professor. Every single case, I check the concentration of antibodies against the spike. And these people, let me give a order to you understand. A normal value is below 36 units, the method that we use here. People who be exposed to COVID is something around 300, 500. People with the symptoms goes up over 1,000, 2,000, showing that's an expression showing that these are being constantly absorbing. So I am extremely happy. I think that the next step will be open some avenues to see if the protocols work. We have a problem to disseminate for all people, because we need to choose the right antibiotic. There are patients who came with sinus that never solve. I need to choose one antibiotics. There are other patients who have no symptoms on the intestine, just the fatigue and memory, and then I need to give just 5 days of ciprofloxacin. So this is individualized. If people are under anticoagulants, I can't give Nattokinase in that dose. So we need to individualize. But the core of the protocol is to restore the healthy microbiome. And I believe the guys who create this, they already know that. They know before us. The people who create.
You muted yourself. You put yourself on mute.
Okay, now which part did you hear the last
time? Well, I wanted to jump in, since you've kind of laid this out. You finished by saying the creators of the virus and the vaccine may have known this. Let me just bring up the paper, since you've described 3 out of the 5 cases now. So let me see if I can bring this onto the stage. This was a brilliant paper. And I think one of the things that impressed me about the paper was that these were serious syndromes, granulomatous disease, seizures, polymyalgia rheumatica, very serious cases. Now, did all 5 of these individuals take the vaccine?
No, there are 2 of them did not take the vaccine. But if
Okay.
you want to know, there are one case that, or more than one case, 3 cases that got worse after the vaccine.
Okay.
That's incredible. And I have a case that might be, okay, go ahead.
But what I want to say to our listeners is this protocol would apply to long COVID or post SARS-CoV-2 syndromes that have not been vaccinated, and also would apply to the vaccinated. So
yes.
Yeah, so I wanted to make that point. The other point is that of those who took the vaccine, did they also have the infection at some point?
Yes, there are. Okay. Yes, all of them were exposed to the virus.
Okay,
but,
so then all 5 potentially had the GI tract as a chronic reservoir of SARS-CoV-2. Is that right?
That's what I believe. We need more studies to do. But that's why I believe, because that's the only reason, that the only way that you can explain our results. And I'm talking not about just this 5 cases. I'm seeing over 500. Right. And let me tell this curious that you're gonna like this case. There is this teenager, 17 years old. She took a shot and developed psychosis, crisis of psychosis. And then she took another shot, RMNA, and got worse the psychosis. And then they look at me and I said, listen, I don't know about the psychosis, but if she's tired, if she's with all these symptoms, I know that we can solve this problem. You know what happened? The mother called that she's very, very, very happy because her child is already in the school. The psychologist doesn't know what's happened, but the kid, she said, doctor, you brought my daughter back in life. Thank you very much. But it was like a luck. And then I talked to Sabine Hayes, and she told me that people who has psychosis, they have no bifidus. That's why I'm concerned with this. And if the bifidus is the major core, as we believe, we have a great solution for the whole people.
Right. Well, let me add some commentary for our listeners. What we've been talking about in the GI tract is called bifidobacterium, or we abbreviate it bifido. And normally the percent concentration of this bacteria in the flora of the colon should be about 15%. And every study done shows that when the bifidobacter is depleted, and it can happen during infection, can happen with bad diets and other
and vaccine.
Yeah,
and vaccine.
And certainly it happens with the COVID vaccine, that the GI tract can't do its normal function. And what we're starting to learn is that there's a gut-brain axis, and it's strongly influenced by bifidobacteria. This is being intensively studied now in autism. And so what I want to understand, in our practice, we go after the spike with very high dose nattokinase, bromelain, curcumin. And then when we use bifidobacter, I'll give you an example. We have 4 types of bifidobacter in this product here from the wellness company. It's called...
And that's good offer to your patients. You are always a step ahead. You are always a step ahead, Professor.
But I even take this myself because, Roberto, you can't believe this, but when I got COVID in 2020, I was very sick, and I contacted Sabine Hazen, and I gave a sample, and guess what? I had no bifidobacter.
That's what we're going to prove, and we're going to develop the protocol. And you are the best. You are the best. You have credibility. Let's spread all over the world.
Right, but here's the good news, right? So we're getting people better, one of the things we don't do, and I want to understand your rationale for it, is we don't pre-treat people with antibiotics. So why don't you explain the rationale for using ciprofloxacin?
Well, I don't give high doses of antibiotics. For instance, I give just 5 days. I decided to give, it was the intuition, the rationale behind this is because maybe the microbiota, the bacteria which are inside the gut, they are making things easier for the virus. So I believe that there are some bacteria that make things easier and other that make things difficult, like bifidobacterium. So I give just 5 days course of antibiotic, 5 days. And I'm going to tell you something. There are some people that I treat, and they said that when you start the antibiotic, after the antibiotic, they already felt better, at least on those distension that not everyone presents, but some present abdominal distension. And so that's why I start antibiotic. But let me tell you something. I have my nutritionist here, and I asked her to design a diet which increase the bifidobacteria. And she studies so hard. And so maybe, and then I having some good results with just diet and the bifidos, and we have good results without antibiotic.
Well, Dr.
But that's why I gave antibiotic. That will be a limiting factor to make this more accessible, let's tell this way.
Well, tell us about the diet that you advise you and your dietitian advise patients on.
Well, I'm going to call my nutritionist, but it's more rich in fibers. Is more there are some like more protein. And I'm asking her because she designed and I see the results. I just asked her to do the job. But now it's good because I'm gonna alert. She's coming here. She's on the room outside beside.
Okay, well, let me ask you this: in defense of antibiotics, is it possible that some patients, if they're very low in bifidobacter, that they could have a bacterial overgrowth of other species?
Of course they have. But if you give bacteria, but if you give antibiotics and then you go and give a lot of bifidum, then you kill the first moment like a reset. It's just an intuition, this. But the fact is I have results and I can't deny these results. But when you give a reset and then you give large amounts of bifidus, and the side effects, sometimes people get obstipated, sometimes they have diarrhea, but then after 5-7 days and 10-15 days, they solve this problem. So the good thing of this protocol is that the medicines that we are using, they are very, very, very low toxicity. And more, they are simple, and more, we have results. I'm very happy now. I'm very happy.
This is a fantastic. We're going to take a break right now for our sponsors. We've been talking to Dr. Roberto Zeballos, who's a well-known physician in Brazil. He was actually one of the first doctors to treat COVID-19 and use various drugs in combination. And now he's innovated in dealing with post-vaccine and post-SARS-CoV-2 infections. We'll take a break for our sponsors, and we'll just have a few seconds of silence, and we'll pick up on the other side.
Okay, thank you.
Let's get real. Let's get loud on America Out Loud Talk Radio and Focal Point Substack. I'm Dr. Peter McCullough, your host, and I'm here with a cavalier, incredible doctor from Brazil, Dr. Roberto Zeballos, and he's as spicy as his name. He has innovated now with, I think, a very provocative paper out in ID Cases. We have it up on the screen. We've gone through the patients involved and his protocol, and I'm asking some questions, and we've covered this initial antibiotics to reset the microbiome, high dose bifidobacter. Now I want to talk about ivermectin and this idea that SARS-CoV-2 can persist in the body, in the GI tract as a reservoir. And And doctor, I was impressed by a journal in a GI pediatrics journal, an article where on endoscopy, 5 months after infection, the doctors found replicating SARS-CoV-2 in the GI epithelial cells. And then a paper that's quotable by Chertow and colleagues, the National Institutes of Health, nearly a year after infection, people who had died, they had replicating SARS-CoV-2 in virtually every organ, including the liver, the skin, all throughout the body. So what we're looking at here is people may have the virus, the replicating virus, far longer in their body than what we originally thought.
That's for sure. But what I always valorize is the observation. And so I believe that the most important source these days comes from the intestine, comes from the gut, because otherwise I wouldn't have such wonderful results. I'm sure that we detect in other tissues, but I believe just because I have the results that the major source comes from the gut. That's the only, and I will leave to you and Sabine Hazen to explain this for us in your studies. But I believe that ivermectin, and we know that ivermectin, it blocks it blocks the binding of the spike protein, which is the harm one. It's the one who is the really poison. It's the toxin. It's all that cause all the most symptoms. And there is a paper that Sabine Hazen published saying that ivermectin can stimulate the growth of bifidus. And they removed this article, but she's right. She's right.
Well, the mechanism by which it may improve bifidobacter is by reducing SARS-CoV-2 replication, not only blocking spike, but blocking nuclear entry. Very good. And, I've been using ivermectin in the McCullough protocol for early treatment since 2020. And I give Dr. Pierre Corey and Paul Merrick and others great credit for advancing ivermectin. I've used all the drugs in acute SARS-CoV-2 infection, early on with hydroxychloroquine. I've found that high-dose ivermectin has the most prompt and most significant effect in severely ill patients with COVID-19. But for a man your size, I would use 48 milligrams a day. Okay. Wow. Yeah. So, and even in long COVID syndromes, what I do is if there are craniofacial, symptoms, which you have in one of your cases, I look for night sweats. If the bed sheets are wet at night and they feel sick, skin rashes, and then I use ivermectin at that dose. Like for you, it'd be probably 48 milligrams a day. For me, it'd be 36 milligrams. It comes in 12 milligram tablets, and I would do it for 90 days.
Wow.
90. So and because we're in different parts of the world and we're taking care of patients, it's not surprising that we come up with different approaches. And when I read your paper, I thought maybe if it's GI tract replication, we can get by with much lower doses and a lower dose frequency. What do you think about that?
Well, there are people, they start to improve after 4-8 weeks. But when they improve, but they are not 100%, I keep for 6 months. And when the people is an old one, it's more resistance to you create a healthy microbiota. So it's 6 months, 8 months, and then the patient come, doctor, finally I'm back after 8 months of treatment. So your thinking makes sense. And let me tell about myself. When I feel more with my fitness is not as good as usual, I take ivermectin 3 times a week and I take bifidus, and the results are incredible. Professor, we have a good solution for this. Here behind me is the nutrition, and I asked her, this is a hero of the planet, Dr. Peter McCullough. He's a hero. He's an open mind. he thinks, and you know her. She follow you, just for you. She follow, and she was the one, and I asked it to create a nutrition protocol. Danny, Dr. Peter asked which are the major compounds, just 5 or 6 of them.
Yes.
Okay. Hang on just a minute. Can you, I want to put you on the screen full time. So let me see what I can do here. Okay.
No, I guess.
Okay. No, that's good. This is good. And your name again?
Yes, my name is Daniela Campi.
Yeah. Daniela Kelby. And are you a dietitian or a nutritionist?
Yes, I'm a dietitian and nutritionist. And this diet, first of all, thanks for having me here. Let me explain a little bit my methodology that I constructed this diet. I divided it in 2 phases. The first phase, I shut down all proteins because I focus to improve the probiotics in the fruits, vegetables, then like chicoria, asparagus, kales, a lot of frutas vermelhas.
Red berries.
Because of the polyphenols and the probiotics, a lot of raw foods for the 3 days the first phase, and the second phase during 5 days. And I introduced a little bit of protein because my focus is to inactivate the proteobacteria because they eating this rest of the protein in the body. So after that, this microbiome has storing with those vegetables and raw foods, green
tell him your results just with diet sometimes.
Yes, and this protocol, the 2 phases, first of all, 3 days in the first phase, and the second phase, I have the 5 days during 8 weeks. And I have incredible results because of I distributing these raw foods, the probiotics along the day, like smoothies with raw vegetables and teas. Espinheira Santa, I don't know if you have in the United States, but Espinheira Santa balances the microbiome.
The results are wonderful.
Yes, but the methodology is that shut down the protein in the first of all phase.
Okay. So initially it's protein restricted. It's raw foods, very high in fiber, leafy green vegetables, cruciferous vegetables. Let me ask you this, because I can tell you what I do in my office. And like you, I've treated thousands of patients now from the very beginning. I'm in my office right now. Let me ask you this. What do you tell the Brazilian patients? And this is a big deal. What do you tell them about drinking alcohol?
Well, I think that there was what I do myself. 5 days of a week, eat for your body. Weekend, eat for your heart. I have a glass of wine with my wife every Friday night, just a glass to enjoy. I believe in good feelings about yourself. I believe when you are in peace with yourself, when you are happy with yourself, doesn't matter if you have problem. I don't call problem, I call challenge. And then you go forward this challenge, goes over this challenge and be a better human. So that's why I believe that we need to take care of our soul at least 2 days a week. That's what I suggest, but never exaggerated.
I know you Brazilians love to enjoy yourselves, and I've been to São Paulo many times and Rio. But what I do is I advise my patients, if they can, during this treatment phase, no alcohol, so a bit stricter. What do you advise them on sugar and starch, like donuts and pies?
Sugar.
No sugar. And during the protocol, I advise that 14 days no alcohol
No
and
sugar.
no sugar. Also, no gluten and no daily like milky yogurt.
Oh, so hang on. Did you say no gluten?
No gluten, yes.
Wow. So you've come up with nearly identical dietary approach that I've taken, because this is what I've found. If a patient is doing all this and they go eat a sugary donut with lots of sugar and starch, they go down and their
That's true.
symptoms come back and they feel much worse. I've seen it over and over again. If they go and they eat 3 pieces of pizza, they go down. If the patients are eating salads and fruits and vegetables and staying on the diet, they markedly improve. What do you tell them about exercise?
Exercise needs to be a habit. I do every single day. And I know that there are a lot of good substances that I release with exercise. But I believe that when you do, because you love yourself, because you are taking care of yourself, there is the beliefs, biology of beliefs. You release substance. I believe this because I saw this paper from Bruce Lipton, and we have a strong influence when you feel things with emotions. So if you are working out because you are taking care of your life, then you'll be healthy. I believe that everything that every single molecule, sometimes they call about irisine, telling that people who does exercise release irisine and this prevent Alzheimer. I believe that the irisine is just an instrument that is a consequence for what you're feeling, and then your organism is able to synthesize substance which gonna protect you. Exercise, and you know what, Professor? I believe that nowadays, if people doesn't take care of their lives with exercise, with diet, with meditation, look inside yourself. If you don't take care of this, you're going to be manipulated. And I believe that nowadays, the gut microbiome, you need to study just to prevent diseases. So it will be as important as a checkup. As a checkup, will be as important as other study your heart, study your lung, study everything. It's important to see how is your intestine. Because nowadays, after the COVID, I'm sure that a lot of people are with an unbalanced microbiome. I know, because when I'm tired, when I'm sweating at night, I take Ivermectin, Bifidus, and 5 days, 6 days after this, I'm brand new again. So I believe that we are living a new era. And the point is, I was afraid how to control all this deaths, how to control all this. And now we have a very suspicious that will be spike. And then we know how to control in the gut, as you already doing with your Bifidus bacteria in your company. You are, man, I'm very proud to be with you here right now. You are incredible.
You know, you've added to this greatly, because the original spike protocol we published in 2023, we didn't include any of the gut microbiome aspects, and the longevity product from the wellness company is actually for longevity. It's not really specifically for spike detoxification, but it has bifidobacter in it. And in the write-up, I'll show the species and the quantity. But I can tell you, I've also found that if patients perspire, if they sweat when they exercise, and down in Sao Paulo you can sweat, that the spike protein and the messenger RNA is believed to be in sweat, because it's been shown to be in breast milk. So, and breast milk is modified sweat. So we know we've got a tremendous opportunity with perspiration. So in Texas, it's very hot. So when I exercise, I sweat a lot outside. And, then at the end, I swim and I cool down. So I know I'm getting rid of spike protein that way. And the other thing I advise, and all the studies are supportive, is hyperbaric oxygen. Every
Oh, I
study
don't
has shown hyperbaric oxygen is
know
beneficial.
Professor, I'm gonna do a small study with Sabine Hayes in here in Brazil, and if you want to be a supervisor or something, it's just gonna increase our credibility if you believe in this idea, and I know that you believe, and I'm very happy that you reached to the same conclusion with your thinking. That's amazing. That's amazing, and so let's make this protocol because all these deaths that are going on, all this fertilization decrease that we are seeing, all this is due one bioweapon called spike. And if we control the source of it, we'll be able to save millions. We'll be able to save millions.
I agree. Now we're seeing antibodies to the spike protein go down. We're using a lab in Germany. It's called Inmodia. The Inmodia lab, I'll include that right up. They can directly measure spike in the bloodstream. They can also measure messenger RNA within cells and the SV40 fragments. So we're writing up cases. But I'll tell you right now, a case we're working on, we know for sure that a man who has not had the infection, so it's negative antibodies against nucleocapsid, but he's taken 3 COVID vaccines, he has circulating spike protein 3.2 years later in his bloodstream.
That's terrible. That's terrible.
So he's had a blood clot, myocarditis, feels sick, and so we are doing the protocol. The one shortcoming, he's never had sustained detoxification with nattokinase, bromelain, and curcumin, and in my experience, it takes about 9 to 12 months. Maybe with the Zeballos microbiome strategy, that may be able to accelerate things to assure the course.
I spoke with Dr. Sabine Hayes because now when I discovered this, she becomes my reference and inspiration. And she said that even the vaccine, of course, you know that, it goes to the gut and eliminate all the bifidus. Mm-hmm. So if we fix this, maybe even if when it's circulating, maybe decrease the symptoms and the risk. But this is just a speculation. We need to study more.
Well, sure. We may just enhance endogenous clearance. Now, before I let you both go, I have to ask one final question. In addition to the protocol that you've published, what other vitamins and supplements do you routinely recommend? For example, vitamin D and others.
Well, I recommend vitamin C since it facilitates the development of bifidus bacteria. Most of people here in Brazil, like me, who take sun, I meditate under the sun. My vitamin D levels it's high, but if I don't think that you can replace vitamin D to help. I don't know what to use if your patients. But if the patients eat well, I don't give too much vitamins. Otherwise, he's going to get gastritis and everything. I just give vitamin C and sometimes vitamin D. She loves supplements. Yeah, I always tell her, please don't give too much.
I want to have her opinion while we have her on. What do you
think? Yeah, I do love, and I focus on the beta-glucan, magnesium, silicio. Also, psyllium fiber. Have you ever heard about psyllium? Psyllium has shown improved bifidobacteria in the exams, right?
Yes, in the tests.
In the tests. Also, polyphenols from red fruits and green tea, matcha tea also improve. And I have been a lot of incredible results when I balance these nutrients along the day in the patients and balancing the microbiome.
Yeah, what we are doing here is first, I give a treatment for 4-6 weeks, and then to make the gut healthy, then I send to her and she does this. But the people really improve a lot, and I think that the future is to eat well, to exercise, meditation, and live life with love, because it goes so fast, and I think life is an opportunity.
No, I think those are sage words of advice. At the Wellness Company, at the high level, our ultimate spike detox, we also, in addition to nattokinase, bromelain, and curcumin, we also include black seed extract, which is Nigella sativa, dandelion root extract, and in our lower level product, we include some other what we call minor ingredients. That's in what's called spike support. And it's interesting how, we end up coming up with ingredients that are similar. In the spike support, we include green tea extract and Irish sea moss. Your green tea extract would be similar to your matcha. I do recommend vitamin D. Of course, I'm not as tan and handsome as you are, but we like to try to have vitamin D levels between 50 and 100. That means most people at 5,000 and 10,000. We also recommend vitamin C. At the Wellness Company, we have a product called Healthy Immunity, and it features vitamin C to make sure people get enough. But the point is, conceptually, we're trying to boost the immune system, improve bifidobacter and the microbacteria, reduce SARS-CoV-2 replication, and clear the spike protein. So it's kind of a multi-dimensional picture. This has been a terrific interview. Dr. Zeballos, any final words for our audience?
Yes. First of all, I think we can do the study that I'm designing with Dr. Sabine Heisen. I would appreciate your opinion. I like to take much of your time. But it's good if we don't need the antibiotics. Antibiotics wasn't intuition. It was my inspiration. But we can make a group with antibiotics and a group without antibiotics and see if the results are the same. So then because it was just like intuitive. But the point is, it works. I'm afraid to change this because it works a lot.
Well, it's not only that it worked, but it worked in severe cases. And, I think in a future study, the outcomes would be, the baseline symptoms. We would measure antibodies against the spike protein and then directly measure spike protein in the blood at baseline. And then in follow-up, we would also measure the microbiome with the progenobiome stool assay at baseline and then follow-up. And then, assess the patient. I loved how you opened the interview about the importance of clinical observation. And I'm just like you, in the setting of a pandemic, we don't have the answers given to us. It's up to us to figure that out. Both of you and I have been in this for the longest time. We're going to have to leave it here. Dr. Zeballos, thank you so much. And also thank you to your staff, your wonderful staff, for being on the program. It's been a great honor.
Thank you very much. My honor. Let it spread and start to do the paper soon. All the best, Professor.
Let's get real. Let's get loud on America Out Loud Talk Radio. This is a McCullough Report and Focal Points Substack. I'm Dr. Peter McCullough, your host.